What is uterine artery embolization and how is it better than conventional management strategies like surgery?
Uterine artery embolization, like the name says, is a purely non-surgical treatment. There is no surgery involved and there is no removal of uterus. So they come with five main benefits that I can mention. It's a minimal invasive treatment. There is no cuts, there is no scars which we see, and a very low hospitalization. I would say just overnight hospitalization, which is required. And the fifth thing is you can get back to your routine on day three, or day three of your procedure. So that's like the key benefit. And saving your uterus is what is important. So the uterus is not removed, it is retained there, and the functions of the uterus are also retained.
Who do you think will benefit most from uterine artery embolization?
We only do treatment for patients who are symptomatic. One is menorrhagia, that is excessive menstrual bleeding. Dysmenorrhea is like very painful menstrual bleeding or pelvic pain, which is there. Then you have frequent urination, constipation, and not the least, but painful intercourse, which is something not spoken about, but these are the symptoms that we most of the time encounter from these patients. And these patients who have these symptoms will benefit the max from these procedures.
What is your clinical experience on the results and present literature evidence of this procedure?
If I have to quote a literature article that you asked me, one of the NIH article, which is like an efficacy on fibroids and its complications. So it gives an overall success rate of almost 97%. That is like very good, far more better than the surgery. And the recovery, everything is far more superior. So when you go symptom wise, because we are treating the symptom, patient comes with a problem, and after we treat, the problem has to go and the disease should not come back. This is the main thing that they want to know. So menorrhagia, dysmenorrhea, they almost hold 90%. If I have to quote exactly, if I recollect well, is around 84% for menorrhagia, and dysmenorrhea is around 88% response that they will see when we do this procedure.
What is radial approach and how is it beneficial for the patient?
We enter through the wrist, I call it the wrist access. So we go through a small hole, we pinhole through the hand, and we travel through the blood vessel into the uterus blood vessels through here. So what makes it very simple is for the patient. Conventionally, it was done from the leg, femoral artery, we call it. We enter through that and we used to go. But doing it from the hand, it is very comfortable for the patient because there is no big bandage around the groin area. And secondly, they can get up, go to the washroom, do all the routines which we see. And one concern about femoral artery, if the patient mobilizes too early, and sometimes there may be an hematoma there, blood may leak from that small place there, which is near the groin, may not be noticed. So if it is done in the hand, the rate of leak is very small. So this kind of concern is washed off. We don't even think of some radial artery concerns when we do from any of the accesses from the radial artery. So those are the main advantages.
What is the message you want to give to general physicians about managing the patients in their OPD settings post procedure?
So they will come back with some symptoms. So we have a very systematic post-care protocol. Usually I see them at 1 week, 1 month, 3 months, and 1 year. Very easy to remember. So most of the complaints will be at 1 week. They may say that, a lot of discharge and clots passing. These are all routine, which is going to happen. So until 3rd week, you may see some spotting, discharge, all that happening. So not to worry about it. You have to just reassure the patient that it will be fine. Just reassuring and giving conservative treatment post procedure would be the message.